Hello everybody, this is going to be your cardiac arrest management and AED skill. For this skill, hopefully you have a good idea because you should already be CPR certified by the time you go test for National Registry. You also have your skill sheet available for you to look at, so you should have a pretty good idea of what to do. For this, they're going to give you a general scenario. When you go in, they're going to tell you how much time you have to do it. I believe this station is usually about 10 minutes, and they will most likely let you continue to do CPR for 10 minutes if you see fit to. Remember, you have to say, I'm done with this station when you're actually done. So go in, check once you get done with your spill, make sure you get time to check your equipment, check your AED, make sure it's an AED that you've used before because it may not be one that you used in your class. So make sure you know how to work it appropriately, make sure it's the same, at least similar to the ones that you've used if you have any idea how to use it. Then you should have either a BVM with a mask or a pocket mask with a one-way valve. And then you should have your appropriate PPE, which would be your gloves, as well as your safety glasses. So at this time, we're going to go ahead and get started. Okay, so BSI, checking to see if my scene's safe. My appropriate level of BSI is safety glasses as well as gloves. My scene appears to be safe at this time. Hey, sir, are you okay? At this time, my patient's not responding. I'm going to send my professional partner to go get an AED and call for ALS backup. We're going to check for a pulse and check breathing simultaneously for at least 5 seconds, no more than 10 seconds. At this time, your examiner should note that your patient's unresponsive, pulseless, and apneic. We need to start CPR immediately. 26, 27, 28, 29, 30. Head tilt, chin lift, give your 2 breaths. Making sure that you have equal bilateral chest rise and fall with each ventilation. Our compression rate is going to be 100 compressions to 120 compressions in a minute. We're going to keep our ratio at 30 compressions to 2 breaths. And we are going to make sure that we allow for good equal chest recoil and compress the chest down to a depth of 2 inches. 30, 2 breaths. Six, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 23, 24, 25, 26, 27, 28, 29, 30.
Your AED is here.
All right, sir, can you take compressions over for me?
Yes, sir.
So my professional partner is going to take over compressions at this time while I attempt to apply the AED. I'm going to turn on my AED first.
Apply pads to patient's bare chest.
I'm going to place my pads in the appropriate spot.
Flashing light.
They've got pictures on them.
Apply pads.
Makes it pretty easy.
Connector.
Plugging in my pads.
Analyzing.
I'm clear, you're clear, we're all clear.
Do not touch the patient. Shock advised.
Continue CPR for me until it's charged.
Stay clear of patient. Deliver shock now.
I'm clear, you're
Press
clear,
the
we're all
on
clear.
button.
Shocking. Shock
Delivered.
delivered. Immediately start CPR. At this time, I'm done with this station. Notice in my second set of compressions, I may have gone a little bit over because I wasn't counting. I was trying to give you that information. I apologize for that. But that is the gist of your skill. Make sure you get your good hand placement. You're in the center of the chest. If you need to measure every time before you start your compressions, then do so. Also, make sure when you're ventilating that you're getting good equal chest rise and fall, whatever mannequin or dummy you're using, and make sure you're doing an appropriate head tilt chin lift every time you're ventilating that patient. Thank you for watching this video. I appreciate it.